comments on items not? Does anybody have any public comments on items not on the agenda at this time? Okay. Just a side note, if you do have anything you'd like to discuss and are not able to discuss it here, you are welcome to email that to Commissioner Mudge, Commissioner Glenn, or myself as well. Our email addresses are on our website. Okay, so we will move on to our next item on the agenda, which is new business, which is an update from Build a Generation. So I was approached by Katie Baldessar, and she is here with us today to give us an update on what she and her crew at Build a Generation have been doing during the pandemic and since their spinoff as a nonprofit. So with that, I'm going to turn it over to Katie to give us an update on the work that they're doing, and then we will have an opportunity to have some questions and answers as well.
Awesome, thanks, Kayla. Are you guys okay if I just share my screen?
Yes, you should be able to. If you cannot, okay, perfect. Yep, you're welcome to do that.
Awesome, let me get to the right one. There we go. And let me get to the right slide. And you present. There we go. Yeah, so I approached Commissioner Marcella and just said, hey, you know, we spun off from the county about 9 months ago and wanted, you know, probably sans pandemic, I would have come back earlier, but it probably makes sense for us to just check in and talk through how things are going, and told her, you know, we have no concerns. We think things are going really well, but wanted to create the space for us to have that conversation. We had a lot of conversations, you know, rapid fire in November and December of 2019. And then I think we've all been really busy since then. So I'm going to talk a little bit, just check in on LCBAG, Lake County Relationship Separation Status, kind of where things are at. Quick update on our work this year. Update a little bit on the MOU, and then talk about anything we need to think about for next year. That might just be, hey, things will stay pretty much the same, but wanted to check in. And then if there's anything else that you all want to talk about, by all means, let me know. So I think key ideas for today, transition, despite 2020 and all of its gifts, the transition seems to be going well. I'm really proud of us collectively, all of us, because I think we did a really good job creating safety and security for LCBAG staff, who are of course former Lake County staff, through the transition. We continue to be just a little incrementally, a little bit more independent each quarter, but we've appreciated the opportunity to kind of slowly separate as we build our own sustainability. And we've been able to continue to provide support for to LCPHA or other Lake County agencies. And I think, you know, this is a theme we've always talked about. There'll likely always be a mutually beneficial and evolving relationship between Lake County and LCBAG. So we talked about that quite a bit in 2019, that it wasn't like we were walking away, we'd never ever work with the BOCC again, but that that relationship is going to change over time. So this is a slide you've seen a bunch before, so just a reminder, why did we transition LCBAG? We needed a more flexible environment in which to work. Our work's rapidly changing. You all wanted fewer things to oversee, and you particularly, which I totally appreciate, you didn't want this really tricky department that was always doing new things. We all wanted to reduce impact on finance and HR so that they could focus on other priorities. And as we became bigger and more complex, we needed additional support and flexibility from those functions. And then our increasing focus on advocacy was tricky for everyone when we were part of a government agency. So just kind of a reminder what's happened to date. So January, I think right before, very end of 2019, our board and you all signed an MOU outlining the terms of our separation. you all separated LCBAG employees and they became employees of a new 501c3. We adopted a new employee handbook. We transitioned to a professional employer model to handle finance and HR. We successfully transitioned payroll. I think all of this is now, in looking back, it's like, oh, of course that all happened. But actually, I'm really proud, you know, of the work that staff at Lake County did and staff at Village Generation did to make sure like no one missed a paycheck, no one lost their health. You know, there was no one skipped a beat in health insurance. All that just happened. We successfully transitioned employee 401ks, keeping them on the same vesting schedule. We determined what we owed you and you owed us, and we sort of settled up. That happened in early 2020. Successfully transitioned employee health insurance. I think, you know, it was really, we were able to find not the same health insurance plans, but very similar ones, so that people didn't feel like they were losing something. We successfully transitioned employee vacation, sick, and personal time. So that was a tricky one. If you remember, we had to kind of figure out how we were going to do that. We secured a VISTA position to help with fundraising, board development, organizational development. And that we just took on our second VISTA last week. We identified a successful fiscal agent relationship based on your relationship with other nonprofits in Lake County, as well as our existing relationship. We transitioned to all kinds of insurance, workers' comp, liability, property, unemployment, etc. So few, I feel tired just remembering all that, and I'm sure you all do too. If we think about what's next, so again, a diagram you guys have seen before. In the past, it actually says past and now it should just say past. We operated as part of Lake County government. Our staff were your staff. You all provided appropriate support, HR, finance, etc. Starting in 2020, you all still remain the fiscal agent on a lot of our grants. You helped support a safe transition to a new organization. You've continued to provide a little bit of transitional support, which we've really appreciated. In some very, you know, small and specific areas. And then moving into, you know, there may, it's hard to know in the future, you know, no, you all still are the fiscal agent on a handful of grants from other nonprofits. We may ask you to be the fiscal agent on grants for us in the future, particularly if they can only come to government agencies. Hopefully we can always operate in a mutually beneficial relationship, but we'll become, you know, at some point we'll really be just like any other nonprofit in Lake County. So kind of key themes there. Biggest transition is complete, right? Like the bulk of the work is done. Yay. We are working on building our financial track record. So brief story, I remember when I was in high school, I had a teacher get a divorce. And she was like in her 50s, but she had never, you know, her mortgage had been in her husband's name and her credit cards had been in her husband's name. And she was like, I can't even rent an apartment. I have, and so I was this all girls school. And so she was, you know, yelled at all of us and said, you get a credit card, like, build your own credit history. So you can think of us in kind of the same boat. There are certain funders who say, you know, you have to have been a nonprofit for 2 years, or you have to have filed a 990, or you have to have done an audit, right? And even though we've existed since 1997, all of our financial history is really the county's financial history. And so we're just working to build our financial track record. We'll file our first 990 at the end of this year, you know, and we'll start to be able to, you know, have people trust us. Some of our existing funders have said, nope, you know, we've worked with you for a decade. We feel good about continuing to work with you. But some newer funders are saying, well, we'd like to see your book, you know, see your books for a couple of years. We're also slowly building our fund balance. That was something that was hard to do under the county. Again, we'll just take time. Every quarter we try to, you know, add to that a little bit, and But that was a place we were particularly vulnerable when we started, because most nonprofits can build that from the beginning, and as they get bigger, their fund balance grows with them. We were a fairly large organization, and had to kind of start fresh with building a fund balance. Okay, questions on any of that? Okay, hearing none, I'll move forward. So, you know, kind of an update, I think, for all of us, right? We had what we planned to do in 2020 and then what we actually did. So we had not anticipated any work on COVID-19, but of course, like all of us, we jumped in and did some of that work. I think we're a unique agency. I recently gave a presentation to the Congressional West Conference, and somebody said, oh, it's kind of like you're the glue in your community. And that is kind of a role that we play sometimes. We're behind the scenes, we're doing work that's unseen, but we're just helping make sure that meetings happen, people come together, they're talking, work moves forward. So throughout COVID, you know, one of the ways we've done that is to convene a regular meeting with public and private partners to share information in a rapidly changing climate. So at the very beginning, that was every day. Now it's once a week. But partners, Full Circle, School District, C4, et cetera, kind of just come together. It's about a 15-minute meeting. Noah, who's on here today, facilitates it. And it just allows us to keep up on each other's work since things are changing so quickly. We've helped convene the Food Task Force. Again, hardly the only player there, but you know, so as the pandemic first started, that regular meeting was just around what's the school district doing to get food out to people? What's St. George is doing to get food out to people? How do we work together? As the pandemic has gone on, and now I think we've exposed kind of an underbelly of food insecurity in Lake County. That group worked with 5 community connectors. So community members that we hired, paid them a stipend. They conducted research in the community around food insecurity, and they recently submitted a plan to a funder to help address food insecurity in Lake County in the long term. So how do we build on what we learned in the pandemic to address this problem now and into the future? We've also supported the Unmet Needs Committee. So that's a collaboration between the Community Fund, Department of Human Services, Public Health, Full Circle, Build a Generation, and Emergency Services. I think I'm not missing anyone. We have, these are duplicated numbers. So these are the number of families we helped. Some families have been helped multiple times. So we didn't assign them numbers at the beginning. So we have no way of exactly separating out exactly how many families we've helped. But 342 households and a little over 1,200 individuals with housing and rent. So those 3 areas, housing, rent, and food, have been by far the top needs that community members have identified throughout the pandemic. And I think the goal in all this work has been to help people emerge from the pandemic from a position of strength. Hard to move forward if you are 6 months behind on rent, and you have to tell your children that you're not sure where their next meal is coming from. Those things in turn cause mental health issues, can cause mental health issues, lead to anxiety, depression, substance abuse, etc. And I don't mean to paint a dire picture here, but I think the work that has been done in Lake County, which by no means has been done only by us, we have played a role, as have so many of you in this room, is really going to make a difference in how our community emerges from the pandemic. And then we played a backbone role in some of the recovery work, again, not leading it, not doing all of the work, but just helping make sure meetings happen, notes get taken, work moves forward, etc. non-COVID work, that, you know, so around like June, July, we started going back to a lot of our regular work, in addition to the new COVID work. So with substance abuse prevention, we've really focused on increasing parent engagement as a protective factor. So both the Youth Coalition and the Communities That Care Coalition, which is adults, have been working on, you know, how do we partner with, or how does youth research and youth leadership help drive parent engagement with young people? And then the CTC Coalition has been thinking about, you know, how as agencies do we come together and help support parent engagement? So the idea of a lot of our work is how can all of us as different parties come together and work on the same issue in order to really have an impact on it. So parent engagement is kind of the big thing that we're working on there. Housing, so the policy advocacy team and the Housing Coalition are gearing up to work. You know, I think they recognize that your board will have some, you know, potentially have some transition. I think definitely have some transition, right? The way the election's shaping up in between 2020 and 2021. So as that new board comes on, working with that new board to co-create policy that will support affordable housing in Lake County. We're also helping to support the Housing Authority as they move into that broader mandate. So in order to do a lot of the work that we want to see in Lake County, in order to build more affordable housing, there needs to be a housing authority that can manage that. So that existing Leadville Housing Authority is working on building itself into an organization that can take that on. Community leaders in health equity, that's a project we're working with between 15 and 20 community members. I called it building their health and racial equity muscles. A lot of times it's staff at agencies who get training in things like health equity, racial equity, being trauma-informed, systems. And so this is a project to really help build community leadership by making sure that community members who aren't employed by agencies also get access to trainings like that, so that they can build their leadership and become stronger advocates in their community. Tenants' rights, kind of big project there is working with landlords at some of the larger manufactured housing parks. They made some, Essentia in particular out at Lake Fork made some great commitments in early 2020, so helping them kind of work through implementing those commitments. Resilient Lake County, that's a project we're working with 18 organizations, which is pretty exciting. That are committed to becoming more trauma-informed and equitable. This year they're breaking into small groups. We realized that becoming trauma-informed and equitable looks different for the police department versus the school district. They're just different agencies. So folks are breaking into small groups to work more specifically on the things that relate to their organizational needs, while also creating this broad community push to become more equitable and trauma-informed. Advocacy, so there we're working, we have a project with Full Circle right now to build the community leadership pipeline. I think, you know, core to all of our work at Build a Generation is building leadership. So we're really trying to think about how do we work more with direct service agencies to make sure that folks that are emerging as leaderships and leaders at Full Circle or at other direct service organizations are then referred on to work with us if they want to, and have access to some of the opportunities that we can provide. We're also working to build our advocacy power in this region. I think as the rural resort region, or whatever, however you want to sort of define our region, we often struggle with having the same voice and power as Metro Denver. I think a place we saw this really clearly was in health insurance. We'll continue to see it is in health insurance rates. It would, you know, frankly, for our community, it would be much better if there was a single rating agency statewide. But it's really hard to convince people in Metro Denver that they should pay slightly higher rates so that our rates drop substantially. So we're working on collaborating with other agencies in this region that work on advocacy and figuring out how do we have a louder voice at the Capitol? How do we really bring our needs as the rural resort region to the state level and make sure that the policy that's happening at the Capitol doesn't only benefit the community members that are closest to the Capitol. Food access, I talked a little bit about this, developed a plan to focus on food insecurity that includes some things like increasing access to SNAP and identifying by hiring a, not at Build Generation, but at another agency, hiring a SNAP outreach coordinator, and then identifying a pilot project to connect more community members to affordable fruits and vegetables. And figuring out what that would look like. There's some great models around the nation, really. So figuring out what that looks like. And then our last big project is the Health and Happiness Project. So we're working with St. Vincent Hospital and Public Health to better understand what contributes to health and happiness in Lake County. So hopefully you all by now have seen a survey that's gone out. That survey was adapted from one that the city of Santa Monica developed, their well-being project. They won the Bloomberg Award for the concept, and then we're able to work with a number of contractors to support them in developing that survey, and they gave us permission to use it and adapt it for our needs. And it's really a survey. Some of these, you know, so many communities have to do these kind of public health assessment and improvement plans. And I think we're trying to make it a little bit more, make it support the community a little bit more. So it's not, we're not just asking people, how many fruits and vegetables do you eat? And how much do you exercise? But really getting to the heart of all the things that matter to community health and well-being. How well do you know your neighbors? Do you think that your children will be able to afford to live here? All of the things that really contribute to health and happiness. So that plan will, that work will help us set priorities for our three agencies. And we're also happy to share that data with you all and any other agency that's interested. We have asked demographic questions at the end, so we hope to be able to disaggregate the data so that we can see where are there disparities or inequities around age, around race, around neighborhoods people live in, around gender, kind of all the places where we might see differences. Okay, before I go there, so that's kind of the update. Any questions on any of that?
Katie, this is Commissioner Mudge. Thank you very much. I appreciate all this work, and I think, you know, as it's mentioned throughout here, the strength and the partnerships that we've seen with Build a Generation, Full Circle, and other partners through COVID especially has been incredible, and I thank you all very much for that. I think a lot of that too in your work in building leaders and empowering folks, giving them resources and the courage to pursue their curiosities and make a change for improvement on their quality of life in our community is probably one of the highest benefits and roles that I have seen Build a Generation play and been a part of myself. I have just a couple of comments on some of those things too. You know, I want to highlight the success through the partnership with COVID and human services, and what, you know, all organizations have been able to teach each other. I think that's been really important also for us as a local county government. I think it's probably helped in promoting and informing the public on existing programs and resources out there for folks to build that trust. And I hope we can continue to do that and point people and educate folks on, you know, what is available, and then hear from you all, leading some of those conversations and being liaisons on how we can continue to improve our services at the county and the city. I wanted to ask about FLTI and if that's happening again, but not necessarily related, but you have your long list of successes here. I would love, I will also wonder if you have any questions for the board, or if there's any other things for us, questions for us to help inform and guide, you know, future applications and grant funding sources, sorry. Because I know, for example, you know, we've seen, I'm happy to see a lot of folks engaged that were engaged with the Housing Coalition. A couple of them are now sitting on the Planning Commission. So I think it's really great and important for folks to, you know, continue to ask those questions of the local government, of those decision makers or the people sitting in those positions, to help that education go back and forth. And that's really exciting. I'm excited about that group of, there was a huge turnover on the Planning Commission. And so I'm personally really excited to see the work that's going to come out of that group and the energy. I wonder about the substance abuse prevention, and you know, we've learned through our Justice Center talks, and then the SIMS mapping, which we'll hear from Jonathan Seamus on, Judge Seamus on. You know, I'm curious to see or to hear if there's work being done with the 5th Judicial District and probation, and how we can, you know, help and support relationship building there. Let's see. Yeah, and I think on that note too, the Health and Happiness Project may not be directly related to the SIMS effort, but I think it's, you know, in as far as I understand, and speaking with Judge Seamus and kind of really aligning, and, you know, as I said before too, COVID and all of us learning, you know, just what is there, and then figuring out a better way for those opportunities to be more accessible to folks, or shift and be better serving for our community members, will be important. And I'm excited that kind of this work is happening around the same time. And I hope that we can also kind of get your help to help promote that work, and explain to people how related it may be, and also how important it is to maybe participate in that piece as well, as a parallel endeavor, if you will.
Awesome. Thanks. I took some notes because that was a lot. So I'm going to respond to a little bit, and then pitch a few of these to Noah, because he more directly oversees some of our work like substance abuse. Yes, I think to address your comment on organizations kind of learning from each other, what I have loved about COVID, there are many things I do not love about COVID. I think what I have loved about it is the opportunity to see both how the collaborative work that our community had done to date gave us a foundation to build on, right? It wasn't like we weren't already talking to each other. It wasn't like we didn't already sort of know who needed to be in the room. But COVID also pushed us into collaboration more deeply than we ever had before, I think, just by virtue of how fast and how intensely that hit us. And I think we have, we've learned, and we all would say, you know, we've worked with partners we hadn't worked with before, that we now feel deeply connected to, which has been really neat. I think with regard to unmet needs, you know, what's really been great there is we've been able to identify, hey, there's a whole part of our community that really can be helped by Department of Human Services. And so how do we funnel people over to there, right? And say like, oh, for long-term support, it'd be great if we could get you signed up for SNAP or LEAP or whatever the program is. And then there's a whole part of our community that DHS can't help, right? Because they're ineligible for a whole host of reasons. For example, one-person households have a really hard time. Janine can speak much better to this than me, but seem to have a much harder time qualifying for services. And there we've really been able to, you know, full circle, kudos to them for stepping into this role. They've really volunteered to set up a family resource center. And we're able, and all of us have agreed to, okay, if somebody isn't going to qualify at DHS, let's funnel them over to Full Circle and ultimately to unmet needs, so that nobody in our community falls through the cracks, right? And whether you get help isn't a function of how many people are in your household or, you know, anything else. And that clarity has been really helpful, right? Because it's like, okay, people come in, because some people call this sort of a no wrong door approach, right? So like people can come in through a variety of ways, and then we quickly figure out, oh no, you should go here, or you should go here. And in that way, we've been able to stretch resources, you know, to help us last through however long this lasts. Noah, can I pitch you, you know, I think feel free to jump in on unmet needs and collaboration. And then also, so FLTI is actually run by Full Circle. I don't see anyone from Full Circle on here, but Noah might know, because he's also a facilitator. And then also Sarah's question about substance abuse prevention and the 5th Judicial.
Sure. Yeah, just around collaboration, I've said it before in a couple other meetings, but what we've been able to do with the Unmet Needs Committee is not normal anywhere in the country, and especially for a community of our size, to be able to mobilize as quickly as we did and move as much money as we have is really a testament to Leadville and Lake County. In terms of FLTI, I don't think there currently is any funding or plans to run FLTI soon, but it is a program that there is a strong desire for. It's been run well and well attended in the past. I also haven't heard anything out of the CSU Extension Office as to how they're pivoting the curriculum to a COVID world. I think a huge piece of that program is the connections that you build with participants and you know, introducing them to different aspects of civic life, and including, you know, bringing in elected folks and having that face-to-face time. So running it on Zoom, I feel like a lot of that would be lost. But I know that it is something that Full Circle looks to continue funding and will hopefully run again soon. And then in terms of the 5th Judicial and the substance use prevention work, the probation office has been part of the Communities That Care Coalition, and they continue to be involved. If there are other opportunities for connection across those initiatives, or other folks in particular that we should be inviting or speaking to, we're definitely open to that.
Hey, Katie, it's Kayla. I was just wondering if you can talk a little bit more about the Housing Authority and the work that they're doing, and who's taking the lead on the Housing Authority?
Noah, can I pitch that one? So we're shifting a little bit to a model where Noah's overseeing a lot of the direct work, so that I can focus on building our muscles as a nonprofit. So I'm going to pitch some of these questions about the work because Noah's a little bit closer to it.
Great.
Yeah.
And Christy actually just turned her video on, so I think she wants to jump on that one. So I'll let Christy take it. Thank you.
Great, thanks.
Hi guys, Kayla, thank you so much for asking about that. So there's a lot of exciting stuff going on with the Housing Authority. Back in January, they had agreed to expand their scope, and then recently they've lost a few board members, so they currently only have one board member, which kind of got us into a little bit of a pickle. But Greg Lobby, Mayor of Leadville, was kind enough to send over some paperwork that he had found in his office to legal to identify how that process could move forward. And it turns out that state statute requires the municipality that the housing authority is funded under, which in our case is the city of Leadville. They're elected to appoint the board members. So Greg had applied to be on the board and now is unable to be on the board since he cannot appoint himself. But the next steps to that is we're going to be recruiting for some board members, getting their bylaws beefed up and into better shape, partnering with Summit County Combined Housing Authority to get some technical assistance on training their new board members and the one existing board member from before. And also some exciting news, we are also hiring a shared AmeriCorps Vista between Lake County Build a Generation and Chavey Housing Trust. And half of their work will be dedicated to supporting the Housing Authority moving forward. So that person will be under me, and so you can reach out to me and I will make sure to introduce you to them when they come on board, which will be at the end of October.
Thanks, Christy.
Thank you, Christy and Noah. I don't think that I have any further questions right now at this point. Does anybody with us have any questions about the update from Build a Generation? Katie, do you have more to present, or is this?
Yes, I have two brief asks after
Okay.
this.
Wonderful. So does anybody have any questions or comments on anything that was presented previously by Build a Generation?
This is Greg. It was my understanding, when Noah was talking about the Unmet Needs Committee, and Katie talked about it also, that the commissioners were considering voting today, as City Council did last week, to commit $100,000 of the $697,000 CARES Act funding to the Unmet Needs Committee to go forward with the prevention of eviction. And I didn't know if that was still your commitment to that today or not.
I would say, Commissioner Marcel, if I may, unfortunately, since it did not make it on the agenda, I think that was our intention and it got lost, unfortunately. But I believe that is our intention, to do that. And my understanding, I was on the meeting, City Council's meeting, and the city dedicated $17,000 of the $100,000 ask. Correct, Mayor?
That is correct.
Okay. So for our next meeting, I think we'll have to put that on our next meeting agenda. Commissioner Marcello, do you have any other thoughts on that?
Sorry, I was trying to unmute. No, I don't. I think that we have a couple of decisions to make in terms of CARES Act funding, so I don't think that we need to necessarily wait for 2 weeks to do that. We might be able to set a special meeting next week, maybe Monday, to address that.
I think that would be wise, because I think that the Unmet Needs Committee is down to its last $11,000, and I don't know exactly where we are in terms of the expenditure of that funding. But with the possibility of evictions on the horizon, we have an issue. Now, we have heard that the CDC has said that evictions can't take place until after the first of the year, but that doesn't really solve the problem of keeping people current. The eviction specter is secondary to the idea of keeping people current with the rent, so the evictions are not part of the problem.
Thank you for saying that, Greg. And it also doesn't solve the problem of our landlords that aren't getting paid in the meantime. So if there's anything that we can do to support making sure that or supporting a vote next week, please let us know and we can follow through on that.
Thanks, Noah and Greg, and I will get that on the planner this afternoon and send out a calendar invite for that shortly.
Thank you.
Yep.
Yeah, that would be great. It is. I will also say that a lot of the funding that's come into that is restricted, right? So it can only be used, for example, for people who lost work in the Vail Valley. So unrestricted, funding from the BOCC is incredibly helpful. So we don't have to turn a family away, even though we maybe have money, but it can't be applied to their situation. So thank you for considering that.
Yeah, thank you.
Can I ask a question on, I'm not sure that we've heard if we have that, and I know Janine is on here with maybe some statistics. Between the city and county, is it an even split of the households that we are able to serve, that we are being able to serve with the Unmet Needs Committee resources?
This is Janine. I don't know if you have better data, Katie, right off the top of the, we have primarily spent a significant amount of funding in the mobile home parks, which would fall into the county. But not all of the mobile home parks are in the county, but that's where the bulk of the requests have come. And it depends on if you're talking about dollar volume or quantity of households. Sometimes the dollar volume per request is higher when it's in the city, but there may be fewer folks in the household. So it's a lot of it is in the county, but we are definitely seeing the need everywhere. I wouldn't say that there's, if folks are in the city, then that means there's a lesser need. The larger housing complexes, Eagles Nest, the mobile home parks, and then also individual housing units, especially where there's a couple of roommates and folks are working seasonally, tend to be a big part of that. Anything else, Noah or Katie, you want to add?
I don't have the number off the top of my head, but if that's something that you'd like before you take a vote, or if there's other information that you feel like you need before Monday, please let us know so that we can prepare that and bring that to the meeting.
Sure. No, I just kind of was thinking out loud. I think you had presented 55 landlords that you were working with, and it was just a thought I had, that there might be more renters that are being served in the county, and perhaps more landlords or property owners that are being served, if you will, or benefiting as well in the city. But no, just a thought. But I think that the board is happy. Appreciative of your work and happy to support this, definitely.
Thanks. And I would reiterate what Noah said, that I think the work that's being, the message that we've kind of given when we reached out to, we have reached out to other funders, is we've developed a pretty good system. We're poised and ready to distribute, to help people, and to create the safety net in Lake County. And but we do need the funds to continue to do it. So we appreciate your consideration of that project. And I think, Sarah, we can, if that's something you want, we can definitely run the numbers on that. But I would say, informally looking at the data, the bulk of the requests are coming from the county. though certainly not all. Anything else on that, right? On anything that I've talked about right now, or should I move on?
Does anybody have anything else for Katie at this point? Or any of her staff? Katie, I think that you're good to go and continue on.
Awesome. So two quick asks from you. The first, I probably should have just brought this today, but I thought I would come in first, ask if it was okay. So when we wrote our MOU, one of the things that we wrote into section 5 was that in your role as a fiscal sponsor, you all would provide every quarter 25% of the total funding that we had in grants. We would spend that money and then you would be reimbursed by the funder. So as of July, that number has changed. And that'll probably happen about every 2 quarters. Might not happen again actually for another 4 quarters. Because all of our grants are on the state fiscal year. So for example, this shift this time, there was a decline in tobacco revenue. And so 2 of our grants that are funded by $835 saw I don't remember what it was exactly now, but about an 8% decrease in funding. Noah's nodding, so I'm close. And then one of our OBH grant is the Full Circle is now the fiscal sponsor rather than Lake County because we applied jointly with them for that grant. So that amount has shifted. What I would propose to do anytime that happens, so I just kind of wanted to get agreement on this, and then what I'll do is anytime that happens in the future, I will just do this, is that I come back to you or submit to you, which should be a very quick vote, an amendment to update Appendix A, which outlines the amount of that 25%. Does that make sense as a request? So it would be a decrease in this case because there was a decrease in all 3 grants.
You just
Katie, I think that makes sense logistically. Would you mind if we could put eyes on that document and sign it on Monday? Would that be, or vote on it on Monday? Would that be appropriate? Yeah,
that would be great. So I will send it to you after this meeting. And what I'll do is, should I just call it like Amendment A, Appendix A, version 9920 or something? Does that sound okay? And then that way we'll be able to keep track of our MOU will stay the same because the MOU just references Appendix A. It says you will provide the amount listed in Appendix A. So does that work? I'll get it to you after this. You guys can review it and then you'll send it on Monday and then I'll bring it to my board.
Yeah, I think that would be great. Commissioner Mudge, do you feel like that would be appropriate?
Yeah, no, that would be fine. And Commissioner Marcel, I'm sure you're trying to schedule between your trainings next week. just remind.
Yeah, so I think Monday we'll try to aim for noon, if that would be okay.
Great. So I'll plan on Monday at noon. And it sounds like you'll talk through CARES Act funding or vote on CARES Act funding as well as this amendment at that meeting. Is that right? Okay, awesome.
Yes.
Great. And then second item, I'm going to pitch to Noah again.
Thanks, Katie. So related to the unmet needs work and all of the work that we've been doing over the last several months, we found out that Mountain View Villages and Mountain Valley Estates, formerly East Fork, both plan on increasing their space rent in October. And so I wanted to talk to you today about how to approach communicating with the owners of those communities. I drafted a quick letter just breaking down the numbers of that we've paid in rent to those two communities over the last 6 months, and essentially saying, we're still in the middle of a global crisis. Our community has been hit pretty economically hit hard economically. Your residents have not been able to pay rent. We've been subsidizing their rent to the tune of $75,000 in Mountain View and $10,000 in Mountain Valley. Would you reconsider this rent increase, seeing as conditions haven't really changed and that need will continue? So I know it's more of is this something that you'd be interested in signing? I can work with one or both of you on changing some of the language. We can soften it up or make it a little bit more explicit. And I can work on having that ready for Monday as well, if you'd be interested, or we can also just send it as the Unmet Needs Committee, as a collaboration of organizations that have been working on this, including the Community Fund and Full Circle.
No, I'd certainly be interested in supporting communications to those property owners, and wonder, where we can leverage some support from the state, as well as, I know we had talked when you guys came to request another kind of wave of funding for unmet needs. We talked about some of those long-term strategies, and perhaps this is a time to start planting those seeds a little bit deeper with those property owners and managers on, and inquiring about what improvements to the property this will serve. Just kind of prying and getting to the root at why that is happening. And I'd love to continue to brainstorm ways that we might create incentives and other programs supported by the county to encourage them to really improve the condition either of homes or the management or utilities to those community members that live in those outlying neighborhoods.
No, I would agree. I would be happy to also support that if you could draft that and get maybe a draft to us before Monday, and we can add that on Monday as well.
Okay. Yeah, I have it ready, so I'll send it over after this meeting.
And commissioners, I'd like to say that even though we don't have any real cachet with those property owners, the city would be glad to sign on to that as well.
Yeah, they're outside of your jurisdiction, but I think we can talk about the $100,000 that you're looking at committing to the effort, and the fact that this is something that wouldn't fly in the city or the county. But okay, thank you all.
Yeah, that'd be great. Thanks so much, Noah and Katie. I appreciate that. Katie, would you like to continue?
Thank you for your support. That's really all I have today. I appreciate your time. I know this is a busy time for all of us, and nobody really has time for people like me coming and giving presentations. But I also think it's really important that we just stay in conversation, that you guys are a huge supporter of us. And so I want you to know what we're doing, and I want you to have space to express concerns or questions or support or whatever it is that you want. But know that we are incredibly appreciative of your support. All of the fact that Lake County won the first Robert Wood Johnson Foundation Prize in the state of Colorado. The fact that, when I get on the phone with a funder, they're saying, wow, I just was talking to somebody who said, hey, can we talk to somebody in Lake County about the work that they're doing up there? The fact that, we've been able, as Noah said, to put together a pretty, collectively, again, with lots of organizations, put together a pretty amazing COVID response plan. All of that is a testament to your support for both our organization and other organizations in this community. So just deeply, deeply grateful.
Thank you so much. And thank you for the work that you're doing. Katie and Build a Generation staff, we do appreciate all the work that you're doing and the community organizing that you all put your heart and soul into. So thank you for the work that you do.
Thank you.
And commissioners, I'd like to add one more thing.
Absolutely.
Especially during this time, I don't know where we'd be without Build a Generation. They are so important to our community. So I'll leave it at that.
Thank you. All right, so with that, we will move on to our second item of new business, which is the SIMS project mapping RFP. Commissioner Mudge, I believe that you have worked closely with Judge Seamus on this initiative, and so I'm going to hand it over to the two of you to present, give us an overview of what SIMS mapping is and what the RFP will be for.
So I will give a very brief overview, but this was something that I believe, or I first heard, Judge Seamus, you can correct me if I'm wrong, in our Justice Center conversations, and of course has been just further highlighted as a need through COVID and meeting the needs of the community. When we talk about all of our resources through mental health and facilities and services that Jonathan is deeply involved in and kind of sees day to day the impacts on our community members. So we plan to go through this process and create better alignment, kind of how I mentioned with Katie's presentation with Build a Generation. I think it'll only further help kind of a unified understanding and effort across the community. And with that general broad explanation, I will pass it along to Judge Seamus for more detail.
So just to give a general background on SIMS mapping generally, it's a process that was developed about 20 years ago through SAMHSA and the National Institute of Health to assist communities in assessing how individuals with mental health and substance abuse issues access services, how people access, how agencies access them, and how any gaps in how that engagement worked could be improved upon. And about 2 years ago, the Colorado State Court Administrator's Office participated in a national gathering, and they affirmed that the process was necessary and beneficial, that they commanded that all jurisdictions in Colorado participate. Subsequent to that, the governor's behavioral health task force also embraced SIMS mapping as a process that would really assist communities in identifying what works, what doesn't work, what gaps there are, and to set forth plans and strategies to improve the delivery of those services. I look at those services as not restricted to just the actual delivery of drug treatment and mental health treatment, but rather all of the systems that impact an individual's success. So it includes vocational services, it includes housing issues, it includes food issues, all of those things that affect whether someone can ultimately be successful or not. For us in Lake County, it's all the more relevant and important to consider doing this now because we're talking about having this enormous investment in this new Justice Center. And so the challenge is how can we leverage this project so that we can improve upon what services we have, which are many, and how we can improve the delivery of those systems. So when we talk about there is no wrong door, how can we increase the number of doors? How can we improve the coordination of all of the services that are being offered? And so to me, it would hopefully help inform what we're trying to do with this Justice Center. It will also be an important exercise in assessing where we do currently have gaps, and gaps we have many, and whether or not some of the solutions we're talking about are going to effectively address those gaps. I mean, things such as there is no inpatient treatment in Lake County. Is that something we are okay with or not? I know that Sol Vista is developing an acute mental health care facility in Salida. That's awesome, but is that really going to help people in Lake County? For people who have competency issues, there's now a huge statewide push to engage in outpatient services, but if we don't have the services or support, then we're going to have problems. Right now, under the status quo, for a lot of the services that we need, we send people someplace else, get them the help, and have them brought back here without any real integration or coordination. And to me, that significantly reduces the effectiveness of what we've done. The other part is just also to just make all of the agencies within Lake County more aware of what we're doing, how we're operating, and so we can be better synthesized, so that on the one hand, I know how awesome Builder Generation is, but although Noah and I, for example, converse regularly, my guess is we can probably elevate how integrated our systems operate and then improve the delivery and also the handoff, so that people are more likely to know the services, have access to services. But then in addition to that, if someone's getting served by multiple agencies, that those agencies are coordinating what they're delivering to an individual, so that the services are better coordinated and are more efficient. So in a nutshell, to me, that's the pitch for going through this. In addition to that, one of the things I'm trying to do, on the assumption that hopefully we will be able to do this in November, is also try to leverage our commitment with resources from the National Center of State Courts and the State Justice Institute to try to help get technical assistance. So once we go through this process, we also have support so that we can implement whatever recommendations we decide we want to implement. And so this morning I met with Patty Tobias at the National Center for State Courts. She's all in to trying to help us develop opportunities to get more funding so that we can implement those changes. Tomorrow I'm doing the same thing with Michelle White at the State Justice Institute, so that my hope is if we make this commitment, and the two commitments are to fund the actual SIMS mapping, the other commitment is to get all the agencies and stakeholders in Lake County to actually participate. And yesterday I did present to IOG to alert them that we're hoping to embark upon this exercise. I think it's super exciting and will really help inform what we've been doing and help direct us as to where we need to be going. And again, with the investment in the Justice Center, my hope is it'll be an opportunity to save an awful lot of money. So what questions can I answer?
I don't, excuse me, I don't think that I have any questions at this point. Janine, do you have anything to add to that? I guess I do have a question. Does the SIMS mapping overlap with services from human services, or how is that different?
So the SIMS mapping will take into consideration the entire county picture, city and county picture. So from a perspective of, you know, what's available to someone with these needs in our county, and what does that look like, and sort of what does that map look like for them, and where are the gaps? So, for example, as Judge Seamus says, if somebody commits a drug-related crime and is told you need to do an evaluation, and in that evaluation they say you need intensive outpatient programming, what does that look like in Lake County? What do they have available to them? If they determine they need inpatient, where will they go for that, and what will their treatment look like when they come home, and what's missing? So that's just one example. Human Services is part of that. In most cases, Human Services is a referring agent for a lot of these services and or a payee or a payor of source. So we can fund these services, but access to them is another thing. If this person in the example I used is predominantly Spanish speaking, what does that look like then? And what barriers show up? So what this will do is build upon the work that the Interagency Oversight Group has already done in mapping resources in our community a few years ago, and then just expand upon that. And really looking at not only the impact on that individual, but what's the impact on their whole family? What does it mean if this person has to travel out of county or stay out of county for their treatment program and can't work anymore? Those kinds of things are what will be looked at. And then really overlapping that, and I think the reason to invest the CARES Act funds in this is what we're seeing right now is the impact of all of these issues with a pandemic on top of it. And what has that done for stress levels for families, for the resources that they've had available to them? Who have they turned to? Is that, family and friends, or are those professionals? And how is that working for people? It's such an opportune time to be able to look at how folks are dealing with crisis. What have been the resiliency factors for them, and how can we build that in our community? And then what's really missing in our community, and how do we build that?
And one of the things that I think is especially interesting about this way of engaging in the process is it doesn't look at it from an agency perspective. It looks at it from the individual's perspective. So it looks at various intercepts as to when might a person need help or be accessible to receive help. And so it looks at everything from the first intercept is things such as crisis lines or possibly school interventions where the courts aren't even involved at all. But I think the research shows the earlier the intervention, the better the outcome. And so it looks at every single opportunity in terms of how a person in this community is or can be engaged with necessary services. And so looking through that lens, the idea is to look at the individual and see how can they reach out to us and how can we reach out to them so that if there is a need, it's identified sooner, assessed sooner, that the services are then implemented sooner. And if they are, then hopefully what the need is going to be more manageable and the result is going to be more successful.
Great, thank you. With that, today we're just taking a vote on placing an RFP out to engage a third party to start the mapping process. Is that correct, Jonathan?
That's right. PRA, which is the entity that SAMHSA had contracted to develop this whole model, is hoping and wanting to do this with us in November. And obviously it's up to us, or to you, not to us, to you, whether or not that's who you want to use or whether it's some other entity. But the hope is that they would submit an RFP and that could be considered to get this project moving.
Okay. Commissioner Mudge, do you have any questions, comments at this point?
I don't recall the how long are we posting the RFP? And just another comment, with some of the community meetings being organized, we might have an opportunity to leverage those meeting times that may be happening simultaneously, but I do not have any other questions regarding the work.
I think when we develop that RFP, we'll develop a timeline with it to post it out so that we can aim to make a selection, like Judge Seamus said, in November. So I would imagine potentially 3 to 4 weeks, and then make a selection from the potential applicants for that process.
So PRA is not already contracted with the state to conduct the surveying and the mapping.
I think they have done most of the mapping that's happened in the state of Colorado. I know, for example, Larimer County just used PRA about 2 weeks ago, and they were very pleased with the results. But I don't think there is any formal contract statewide for them to engage in these services.
So I think we are fairly close to developing an RFP. And then we'll be able to get that out in the next couple days, is my understanding. Get that posted anyway.
I'll move that the county approves the publication of a request for proposals for SIMS mapping as soon as possible.
I will second that. Any further discussion, Commissioner Mudge?
No, I don't have anything further, thanks.
All right, I don't have anything further at this point either. Thank you, Judge Seamus, for helping drive this conversation, and Janine for also recognizing this as an important need, especially through the pandemic. We do appreciate your work. All right.
Thank you. Appreciate it.
Thanks. All right, so seeing no further discussion, all those in favor? Aye.
Aye.
All right. Thank you for joining us today, Judge Seamus. We appreciate it.
Thank
appreciate
you.
The next thing on our agenda today is the, let me grab it here. CDOT right-of-way permit applicant authorization regarding the Hayden Meadow Trail. Commissioner Mudge, I believe that you have some information on this from your conversations with LCBAG and Mike Conlon, so I will let you talk us through this.
Okay, and I can pull up the letter to CDOT if we need, but I'd send that to the board. So this is a follow-up from the conversation and the presentation of Mike Conlon a few meetings ago to the board regarding the connection trail project going under the overpass by Hayden Reservoir. And so the letter that was drafted is just authorizing Mike Conlon to be the applicant on the county's behalf, as we formally decided to then shepherd that project and forward from the point that Mike Conlon had brought it at the point that he presented it to us the other week. And so this is just a letter authorizing his ability to submit the application for the special use permit, which doesn't change any of the scope of work. It is just getting it on the radar and on the list for CDOT as a project. The one thing, there were a couple of question marks on the historical evaluation and assessment or inventory that was going to be taken, and then a couple of other pieces that we do need to follow up with on Public Works for something like the the weed barrier membrane and dirt work. And so those pieces will continue to be presented to us, and I'd like for us to move forward on his ability to apply for the special use permit.
Great. I don't feel like I have any questions at this point. Once we authorize him to be the applicant on the county's behalf, then what will be the next step?
I will submit the letter to the appropriate CDOT contact, and he can fill out the application on the portal, which is not very complicated. He also houses a lot of the documents that is required to do so, as he's done a majority of that work as he presented to us by direction of the LCBAG group. And I guess if there aren't any further questions, I'll make a motion to authorize Mike Conlon as the county's applicant to CDOT for the special use permit regarding the right-of-way on the Hayden Pond Trails project, and request and require that we get updates on the stages of the project as they are completed and as he hits tasks and gives the county clear outlines of both the in-kind and other financial commitment that may be required of the county, or requested of the county, rather.
I will second that. For further discussion, I just want to make sure that Patty was able to follow what your motion was, to document that correctly. So allowing him to be the applicant on behalf of the county with
the requirement that he gives us status reports and informs us of any changes to the tasks and in-kind and financial requests of the county.
Patty, just want to make sure you're good with that language there. We have a motion and a second.
I have that. That's fine.
Okay, good. Thank you very much. I appreciate it. Commissioner Mudge, do you have any further discussion at this point?
No, I don't think a lot more will be able to be completed before winter comes, but there is a task or two that would be beneficial for him to move forward on in preparation for the springtime. So this will be good news to the LCBAG group tomorrow morning. There will be a LCBAG meeting tomorrow morning.
Thank you, Commissioner Mudge. If you have not received the call-in information for the LCBAG meeting, please contact Commissioner Mudge or myself. We just had that Zoom information come through. We'll get it updated on our planner and posted to the website this afternoon for that meeting tomorrow at 9. All right, seeing no further discussion at this point, all those in favor, aye. All right, thank you. Was that an aye vote, Commissioner Mudge?
Aye, yes.
Thanks.
Positive, affirmative.
Okay, so the last things we have on our agenda today are the reports, minutes, bills, and payroll. I will make a motion that we approve the Veteran Service Officers Report for August 2020 and the bills and payroll for pay period ending August 28th, 2020.
Second.
All right, any further discussion?
Nope.
All right, seeing none, all those in favor, aye?
Aye.
All right, thank you very much. Patty, I will coordinate with you to get an agenda and posting ready for Monday at noon. Sorry, we're homeschooling today and it's PE time. Almost done. Abby, okay, settle down. I'll coordinate with you to get the agenda and planner ready for Monday for our conversation around those action items from today. And that's it. So Commissioner Mudge, do you have anything before we adjourn today?
No, I don't. Well, actually, I do. There's a rally being organized in support of our first responders coming up on Friday. And so look for more information on that and get out there and support them.
Thank you. Last piece of information, we'll have our public health updates moved from every week at a Tuesday work session to our regular commissioner meetings going forward. So at our next commissioner meeting, we will have an update from our public health director on our response to the COVID pandemic. Those will also be taped by Dr. Lisa and posted to our Facebook page and our new website once that goes live. So that should be in the next couple days. So with that, we will go ahead and adjourn this afternoon at 2:27 p.m. Thank you all for joining us today.
Thanks.